So I recently came across some really interesting news about the future of the DSM. That is the manual that therapists, psychiatrists, psychologists, and physicians use to diagnose mental health disorders like generalized anxiety, schizophrenia, and bipolar disorder, and neurodevelopmental disabilities like ADHD, autism, and dyslexia. And this news immediately made me think about the assessment work that I do. I'm Dr. Blied, a clinical psychologist licensed in California and New York. So, one of the directions being discussed is a broader approach to diagnosis, one that places more emphasis on the whole context of a person's life. That is, their development, environment, socioeconomic status, their culture, their daily functioning, and the quality of their life. There's also greater attention to symptoms that can cut across or overlap with diagnoses like sleep disturbance, fear, irritability, and eventually a framework for also incorporating biological findings and biomarkers as science develops. Here's what I appreciate about this direction. It reflects something that is so important in assessment. People rarely fit into one little diagnostic box. When I'm evaluating someone, I'm not only asking whether or not they meet diagnostic criteria for ADHD or autism or bipolar disorder or OCD or learning disability or another diagnosis. I'm trying to understand the bigger picture, how they think, how they function, what their history tells us, what their strengths are, what might be contributing to their difficulties, how their brain works, and how all these pieces fit together. Because two people can have the same diagnosis, but completely different experiences, different needs, and different strengths. A diagnosis can be incredibly helpful, but it should just be the beginning of understanding and not the end of it. To me, the value of a comprehensive assessment is that it helps us move from simply naming what is happening to understanding the person and understanding them well enough to know what will actually help. And if the future of diagnosis is moving toward a more complete understanding of the person, not just their symptoms, I believe that is such a meaningful step forward. Because ultimately, the goal isn't just to get the diagnosis right, although that is an important goal. It is also to make sure that the person feels accurately understood and that we learn what actually will help them in their next steps forward. So, getting an explanation for their experiences and a right path for their next steps. Hope this was helpful. Check out the article yourself.